So, Bismillahirrahmanirrahim. So, today our topic is in continuation of our introduction of dosage forms. Today we'll learn about what is the liquid dosage form. You can see that these are various types of liquids, syrups, so many types of fall under this category. So first, they have a two-phasic. They have monophasic and they have a biphasic. One liquid is a monophasic and another is a biphasic. What they are used? They are indicated for what? The liquid forms are meant for internal, parenteral for injectables or external use. They are available in two phases. One is monophasic, second is biphasic, means one phase and two phase, more than two phases. So if we go for first, monophasic liquid dosage form is that it is a monophasic dosage forms are represented by true or colloidal solution. You know about colloidal solution very well about that. We may have learned in various in physical pharmacy wherever what are colloidal are. So they are true or colloidal solution. The component of the solution which is present in large. So what then quantity is known as solvent. Which one is the solution is large is known as solvent. Whereas the component present in a small quantity is termed as a solute. You better know about these two things, solvent and solute. It is a more quantity in that liquid is a solvent, the less in proportion is that is solute. So what they are doing, they are in purified water is mainly used as solvent. Other pharmaceutical solvent are also available for mostly simple syrup. The purified water is mainly used as solvent for majority of monophasic liquid because just to keep its stability. We don't use an ordinary tap water, so it must be purified water so it can keep its stability as required in that formulation. So a solution mostly is homogeneous because the solute is in an ionic or molecular form of subdivision. In case of colloidal solution, the solute are present as an aggregate, although they cannot be seen by the naked eye or under ordinary microscope. So that one is colloidal solution and one is the homogeneous solutions. Mostly both are in a homogeneous state. So monophasic liquids, dosage forms are available as what? One is liquid for internal use. You may know about syrups, elixirs, linctus, drops, and draughts. There can be syrup, elixirs. This is elixir over there. Linctus, drops, and draught. These they have these shapes or their forms. Second, liquid for external use, which are of two types: liquids to be applied to the skin, liniments, and lotions. You may have prepared for formulation and practical liniments. So liniments and lotions, they are applied on the skin externally. And the second is of B is that liquid meant for body cavities. The third class is that liquid meant for body cavity. Example, gargles. You may have throat pains, mouthwashes, eye drops, eye lotions, ear drops, nasal drops, sprays, and inhalations. Now understand that the different thing in that. And first is syrups, elixirs, linctus, drops, and draught. For liquid external use, you may have liniments and lotions. Liquid meant for body cavities, gargles, throat pains, mouthwashes, eye drops, eye lotions, ear drops, nasal drops, sprays, and inhalation. Inhalation. These are the various type of liquid dosage forms. Further, we start with the syrup. So you know about we have prepared in the lab syrups. So simple syrup is a saturated solution of sucrose in purified water. So what you add? Sucrose, sugar, add in a so it's a simple syrup. The concentration of sugar must be up to 66 weight by weight. The syrups are sweet, viscous preparations. The syrups containing medicinal substances are called medicated. If they have some medicinal substance added over there, they are called as medicated syrup. Those containing aromatic or flavored substances are known as flavored syrup. So you have simple syrup, medicated syrup, and flavored syrups. Syrups are very commonly used for the following reason, where they apply, and the indication is that first, syrup retards oxidation because it is partly hydrolyzed into reducing sugar such as levulose and dextrose. Now, levulose is a monosaccharide. You go to that levulose is a monosaccharide. You have learned this saccharides, I think, in biochemistry over there. Second, it prevents decomposition of many vegetable substances. Syrups have high osmotic pressure, which prevents growth of bacteria, fungi, molds, which are chief cause of decomposition and solution of vegetable matters. So that's why the percentage of 66 by weight is added, because at this percentage, bacteria, fungi, molds cannot grow. Third thing is that they're palatable. Easily you can take, you can palatable. Due to sweetness of sugar, it is valuable vehicle for the administration of nauseous substances. So when it's sweat, you can easily take that one. Otherwise, they may have some other syrups. They may have nauseous taste over there. So third thing is that they are very palatable due to sweetness of nature. So they further divide in two groups. Syrups prepared by simple solution or admixture. Example: syrup ginger, syrup orange, and syrup lemon. A is a syrup prepared by simple solution or admixture, just syrup ginger, syrup orange, and syrup lemon. B is syrup prepared by process of extraction, Tolu syrup. There are two types of one is simple added in that is simple syrup, and second is the by a process of extraction of Tolu syrup you can have seen over there. Here's the formulation, but we have to learn that elixirs. Elixirs are sweet, aromatic preparations and are usually colored. Elixirs are ethyl alcohol, 4 to 40%. They have water. Glycerin are propylene glycol. Flavoring agents, syrups, and preservatives are added over there. The medicated elixirs usually containing very potent drugs such as antibiotics, antihistamines, or sedatives. So in medical, they may contain sometimes antibiotics, antihistamine, antihistamines, or sedatives. Now, flavoring elixirs are used as flavors and vehicle. So there's the example we learned. The following example, some of commonly used elixirs. You just go for the linked tests. The linked tests are viscous, liquid, and oral preparations that are generally prescribed for the relief of cough. So certain you need for the cough syrup, you can use a linked test. What they contain? They contain medicament which have demulcent, sedative, or expectorant action. Easily they can use for demulcent, sedative, or expectorant action. Linked tests should be taken in small doses, sipped and swallowed slowly without diluting it with water in order to have the maximum and prolonged effect of medicament. Simple, you have to sip the dose which is required for linked tests. Simple syrup is generally used as a vehicle for most of the linked tests. So you have added in a lab that we added simple syrup and that to prepare some formulations. Tulu syrup is preferred in certain cases because of its aromatic color and flavor. Moreover, it is believed to have a mild action also of that tolu is there. Then there are drops. Now, these are liquid preparations meant for oral administration. They are soluble vitamins such as vitamin A and D concentrates, fish liver oils are presented as drops for administrations. Since these preparations contain potent medicaments, the dose must be measured accurately. I must advise you whenever you take a dose of a drug, it must be exact which is required. Don't take. That's why I told you you have various measuring tools at your home. You have teaspoons are there. You have dessert spoon over there. So you must have measured accordingly the dose which is required. The underdose cannot cure the disease, and overdose can provide different side effects. The two methods are commonly used for the purpose. A is use of dropper, which is accurately graduated in fraction of a millimeter. So drops can be given with the dropper. It also can known as phial, PHIAL phial. So it can be given with the help of that dropper. So just you have to take what drop is needed. In syrup, you can have the syrups with spoons, but hair drops, they can be used with the help of a dropper. So how much drop you needed, they have added over there. Second, use of pre-calibrated dropper in which the number of drops equivalent to the prescribed dose of particular preparation being administered is known. So calibrated droppers can be used whatever how much drops you require for such dosage forms. The size of drop depends upon the surface tension, viscosity, density, temperature. Then we go for the liniments. The liniments are liquid and semi-liquid preparations meant for the application. So earlier preparation were used for the oral preparation. Now liniments, they are applied over the skin. So liniments are usually applied to the skin with friction and rubbing of the skin. So you have to rub over their skin when you apply a liniment. The liniments may be alcoholic or oily solutions or emulsions. Alcohol helps in the penetration of medicaments into the skin and also increase the counter irritant or rubification. So it is a vehicle. What it do? It increases its counter irritant or rubification action. So the drugs can introduce through the skin. Archis oil is used in some liniments which spread more easily on the skin. Soap is also included as ingredients in some of liniments, which helps in easy application of liniments on the skin. Generally, liniments contains medicaments possessing analgesic, rubification, soothing, and counter-irritant or stimulating properties. Be cautious. A liniment should not be applied to broken skin because excessive irritation. It can be applied where only an arm is no on broken skin. So these different formulas of liniments you can have. Then we go for the lotions. So lotions are liquid preparations meant for external application without friction. You certainly apply lotion when you on your face or your body whenever you require. So lotions are liquid preparations meant for external application without friction. They're applied direct to the skin with help of some absorbent material such as cotton, wool, or gauze soaked in it. They can be used for local applications. Lotion may be used for local. So there is a calamine lotion, a formulation of calamine lotion over there. It contains zinc oxide, bentonite, sodium citrate, liquefied phenol glycerin. So they apply with help of a cotton wool or some whenever they apply over the body. Then gargles. Sometimes you use gargles when you have sore throat, whatever. So you have gargle or mouthwashes. So gargles. Gargles are aqueous solutions used to prevent or treat throat infections. They are usually available in concentrated form with direction for one dilution with warm water before use. So these are diluted. They have to take some ratio of their solution with water. So then you have to put gargles. Whenever you choose to take some time cold things, ice cream or milk, you have to drink. So after that, you must go for gargles with ordinary water or with some medicament gargles. They are brought into intimate contact with the mucous membrane of throat and are allowed to remain in contact with it for a few seconds before they are thrown out of the mouth. They are used to relieve soreness and mind soreness. So they do not go inside your stomach, just you gargle inside the mouth and you have to spit out. It's only for the mouths where they are to be applied. They may not be entered inside. They don't go inside your stomach or they don't pass through the pharynx. Now, what they include? Phenol or thymol is generally present in small concentration for its what they have phenols and thymol. Antibacterial activities of, of potassium chlorate is also included in gargles for its weak astringent effects to tone up a relaxed throat. It also stimulates secretion of saliva, which relieves dryness. Example, phenol gargles, potassium chloride, and phenol gargles. You see in the picture how these gargles have taken the gargle inside mouth, then they are so round inside, move inside the mouth, then they have to be spit out. Potassium chloride and phenol gargles, you can have a formulation. Later we can discuss. Then mouthwashes. After the gargles, mostly you need mouthwashes. So these are aqueous solutions with a pleasant taste and odor used to make clean and deodorize the buccal cavity. Similarly, the gargles are also used in buccal cavity and these mouthwashes are also applied in buccal cavity. Generally, they contain antibacterial agents, alcohol, glycerin, sweating agent, flavoring agents, and coloring agents. What they contain? Antibacterials, chemicals in nature, alcohol, glycerin, sweating agent because it must be palatable, flavoring agents, and coloring agents. So mouthwash contains a liquid of the forms. So they may have sodium chloride, they may have sodium bicarbonate, they have zinc sulfate, they have zinc chloride. So these gain the formulation of mouthwash we will prepare in our lab. Then there are throat paints. Now throat paints are viscous liquids preparation used for mouth and throat infection. So next dose is throat paints. Now glycerin is commonly used as a base because being viscous, it adheres to mucous membrane for a long period and it possesses sweet taste. So in throat paints, mostly the base is for glycerin. You can have a formulation of iodine paint compound. It's also known as Mendel's paint. It's available mostly in pharmacies. If you go over there, known as Mendel's paint. Sprays. Now the next is sprays you have to do. The sprays are preparation of drugs in media which may be aqueous, alcoholic or glycerin. They are applied to the mucous membrane of nose or throat with an atomizer. With the help of some atomizer or with the help of some device, the sprays are used. Mostly you have deodorant you have to spray over the body when you're coming for the class or when you go outside or you from different gathering, you apply certain deodorants or perfume over there. But these are spray, these are medicaments. What they are applied in the buccal cavity. The throat sprays must be sprayed for a special type of atomizer with the help of a nebulizer or whatever it is. What they do, they remove large droplets by a baffling system. Only fine droplets are required so that they may reach the lungs. That's how you spray you need apply inside the mouth. Adrenaline and atropine spray formulation over there. Then they go inhalation. So when you need inhalation, so what they are liquid preparations containing volatile substances and are used to relieve congestion and inflammation of the respiratory tract. So earlier we were using the drugs which are breathed to the mouth, buccal cavity. Now for the infection of the lungs and other things, you need some inhalations. The inhalations containing the volatile substances which are volatile at room temperature may be placed on an absorbent pad or handkerchief to inhale their form. So you may have some you have to take these inhalation or in a room temperature place on an absorbent pad. Sometimes then you have to inhale. In other cases, inhalations are added to hot but not boiling water, and vapors are inhaled for about 2 minutes. So sometimes uh, when you have sore throat, the doctor says you go and have a steam inhalation. What you do, you have to boil the water and take steam. But these are the drugs. Similar, these has to be inhaled. So there's a menthol and eucalyptus inhalations. You have menthol oil, eucalyptus oil added, water to produce thousands. So this has to be inhaled. The nasal drops, these are solutions of drugs that are installed into the nose with a dropper. Now, sometimes you may have an experience as you apply nasal drops when there is a congestion, you have a sinus, or you have a flu, you need certain nasal drops. So, with the help of dropper, they have to be applied. These are usually aqueous and not oily drops. Since the latter inhibits the movement of cilia in the nasal mucus and if used for long period may reach the lung and cause acquired pneumonia. So nasal drops should be isotonic, having neutral pH and viscosity, similar to nasal secretions by using methyl cellulose. You see how that subject is taking that nasal drop, lie over there, and then they have inserted in the nostril. Then you may have an exchange of eye drops. These are sterile solutions or suspension of drugs that are installed into the eye with a drop. Again, they need because you need exact dose, so you have applied with the help of a dropper. The eye drops are usually made in aqueous vehicle. It should be sterile, isotonic with lacrimal secretions, buffered, and free from foreign particles to avoid irritation to the eye. A suitable preservative like phenyl, mercuric nitrate, benzalkonium, chloride, chlorhexidine acetate may be used to prevent bacterial or fungal growth. Eye drops usually contains substances having antiseptic, anti-inflammatory, anesthetics, and myotic properties. The eye drops are generally prepared by dissolving the medicament in the aqueous vehicle containing one of the prescribed antimicrobial substances and any other preservatives specified in the individual monographs. So now the solution is clarified by filtration and transferred to the final containers, which are then closed to exclude microorganisms. The sterile, the sterilization is done by autoclaving or by heating with bactericide at 98 degrees Celsius to 100 degrees Celsius for 30 minutes or by filtration through bacteria-proof filter. The eye drops should be packed in neutral glass container or in a suitable plastic container. The glass droppers are made up of neutral glass. The teats are made up of rubber, which are compatible with the antimicrobial substances to be used in the formulations. The following precautions are required to be observed while using eye drops. First, if the dropper is separate, always hold it with the tip down. Never touch the dropper surface. Never rinse the dropper. Never use eye drops that have changed color. When the droppers is at the top of the bottle, avoid contaminating the cap when removed. After installation of drops, do not close the eyes tightly or blink moreover than usual, as this may remove the medical medicine from the place where it is needed. So these are precautions when you apply these eye drops. Eye lotions. These are the aqueous solutions used for washing the eyes. Mostly, sometimes you use these contact lenses, you need eye lotions. The eye lotions are supplied in concentrated form and are required to be diluted with warm water immediately before use. Eye lotion should be isotonic and free from foreign particles to avoid irritation to the eye. They are required to be prepared fresh and should not be stored for more than 2 days, as the lotion may get contaminated with microorganisms. So there are sodium chloride eye lotion and sodium bicarbonate eye lotions. Ear drops. There was eye drops, now another one is ear drops. These are solutions of drug that are instilled into the eye ear with a dropper. These are generally used for cleaning the ear, softening the wax, and for treating the mild infections. The solution is generally prepared in water, glycerine, propylene glycol, and dilute alcohol. Other vehicles like glycerine and propylene glycols are preferred. So there are sodium bicarbonate ear drops, phenol ear drops, whatever it is. So next is the biphasic.